Um, Good morning, good afternoon, everybody who's online. I'm very excited to be here. My name is Arnold Timmer, and I work with the Iodine Global Network. Thank you, Mawuli and organizers for this session and for organizing this very important exhibition fair. Very interesting sessions. And this session is a panel discussion on digitalization and data systems innovations, or best practices in monitoring and evaluation. I think we can take this a bit flexibly in terms of the entry point and what people would like to share. First of all, I would like to make a round to have every panel member introduce themselves, so you know who's on the panel. So, Jonathan, can I start with you?
Sure. Good afternoon, everyone. It's a pleasure to join you. I'm Jonathan Gorstein. I'm with the Gates Foundation, and I lead our nutrition data related efforts. But prior to joining the Gates Foundation, I was the executive director of the Iodine Global Network, and I'm really looking forward to maybe reflecting on how we've been able to use metrics and data as practically as possible in order to drive universal salt iodization programs as a stepping stone to other fortification activities. Thank you so much. A pleasure to join.
Thank you, Jonathan. And why don't we go to your right hand, who's in the same place as you are, Francis?
Hi, lovely to meet everybody. My name is Frances Knight. I work at the World Food Programme. I'm also affiliated with London School of Hygiene and Tropical Medicine, and I lead a project called MIMI, which is modelling and mapping the risk of inadequate micronutrient intake. So we're really focusing on using secondary data and modelling to fill evidence gaps around micronutrient intake and the potential to improve it. Thanks.
Thank you. Very much looking forward to your inputs. Next on the list is Becky.
Hello, everyone. My name is Becky Sang. I work as a senior technical advisor for the Food Fortification Initiative. One of the projects that I support is the Global Fortification Data Exchange, which hopefully is very familiar to the attendees here. If not, I can give a brief introduction later on. But the objective of the GFDX, which is what we call shortened, is to really provide transparent information around food fortification programming and its opportunities so that others in country can make decisions to improve food fortification and thus improve dietary intake. Thank you.
A very good morning, Becky. I know it's very early for you in Seattle. Next is Adetola Otunla from GAIN in Nigeria. Welcome.
Thank you, Arnett. My name is Adetola Otunla. I work for GAIN, Global Alliance for Improved Nutrition, Nigeria, and I currently serve as the acting project manager for large-scale food fortification program. I lead the large-scale food fortification program in GAIN, Nigeria, and one of the projects that we're doing, which is what I'll be focusing more on this panel discussion, it's on a digital platform that ensures fortification data traceability. So during the panel session, I'm hoping to talk more about it and also share the insights with everyone. Thank you.
Thank you very much, Adetola. And last but not least, it's Zanga Traore from CRS, I think Burkina Faso, right? Zanga, over to you. Thank you. C'est à toi.
Yes, effectivement. Bonjour à tous. Moi, c'est Traoré Zanga. Oui, je suis actuellement chargé de l'utilisation des outils technologies et de l'information dans le cadre de développement au niveau du projet Large Scale Food Fortification. Je suis basé au Burkina Faso. Il faut dire qu'au Burkina, nous sommes en train de conduire un projet pour mettre en place un système digital qui intègre les données de la fortification alimentaire à grande échelle. Cette plateforme regroupe plusieurs acteurs du secteur privé et des acteurs étatiques. Donc, C'est un ensemble de données intégrées et qui permet de faire un suivi et permettre aux décideurs de prendre des décisions éclairées. Merci et bonne séance à tous.
Merci beaucoup, Zanga. Really pleasure to have you. So just a few words on how we plan to run this session. It's very much free for all in terms of what you would like to tell and share with the audience. The audience, you can share your questions. I must admit, I may not be able to follow all the questions and also focus on what people are saying in the panel. So I may not be able to address all the questions in the session, but I'll do my best. Why don't we start with Adetola to hear a bit from Nigeria or from Gain's perspective about your work there and how it relates to this topic.
Yeah, thank you so much, Hannah, and thank you everyone for this opportunity. Yes, so I'll be talking about the Digital Fortification Quality and Traceability Plus. It's a mouthful. It's a platform that was developed. Actually, this is being implemented in three GAIN countries, Nigeria, Bangladesh, and India. I would be trying to focus a bit more on the Nigerian case study. So this platform, it's the place where participating stakeholders, which includes premix producers, food producers, and even the government's regulatory agencies, they can actually upload and share accurate and traceable food fortification data. So the idea is to ensure transparency, to ensure traceability, trust, and effectiveness, even accountability across the entire value chain of the system. So it means that the premix producers on sending the premix order to the producer, you are actually uploading your data, your fortification data itself actually on the platform. The food producer also gets to input fortification data on the platform. Then right there on the desk of the regulatory agencies, they can actually have access to this data itself to understand what exactly is this fortification data. So it's about digitizing the process that is working currently and even ensuring traceability. Part of the challenges of food fortification, we had a lot from different sessions since yesterday, is actually about quality. And then, at times the challenge is we're not so sure of where the quality challenges are coming from. Is it from the premix producer? Is it from the food producer? Where exactly is this challenge coming from? So the platform helps for traceability. We're able to trace we're able to trace the fortification process along the value chain itself. And the good thing about this is that this system was developed as a co-creation with the different stakeholders. So having the premix producers understanding what kind of fortification data they deal with normally, same with the food producers and even the regulators. So when they go for their inspections, what kind of data are they actually looking out for? And using this to actually develop a platform that typically mimics what they do and giving it to them in a more effective way to say, you have the data right now at your fingertips, then we are able to make decisions, policy works, actually based on this data itself. Anand, I don't know if you want me to go forward or just stop a bit here while the questions going.
Maybe some more pointed question, and I'm more acting like a journalist here. So I find it's very interesting that you bring all the different stakeholders together and look at the different data needs, because each of the stakeholders has different uses for the data that they collect. And the co-creation and transparency are keywords that pop up in your presentation. What I'm wondering is, in terms of, can you reflect a little bit on the results? How well is it functioning? And also on the scale, is it, widely adopted in those individual countries? And how do you look at sustainability?
Okay, thank you so much. Yeah, the DFQA Pulse platform is actually, it's a start way to say that this has been done in Nigeria, implementing it with Technoserve. So Technoserve relates with the producers, while again does most of the public sector relation. I would say that at this point, we are concluding the pilot phase. And currently, we're starting with edible oil, which is in Nigeria, vitamin A fortification is what we do with edible oil. We actually plan on scaling up after this based on the lessons we've learned and all the inputs we've gotten from this to scale up to other mandatory food vehicles in Nigeria. Also, talking about the benefits, I'll say a significant benefit for producers is that it helps them to also develop their internal quality system, right? They are able to pinpoint wherever any compliance challenges can actually happen, even before sending out the data itself, even on the cost of their production. Now, I would remember that yesterday when Sean was talking, he was mentioning the fact that food producers are actually fortifying, and they have a quality system, right, that is in depth within their systems. Now, this also helps their quality system. And also, mind you, we have different levels of these producers, right? And their ability for this quality systems, it's varies, right? So with this DFQ2 Plus system, it enhances their quality system. You can already pinpoint any potential challenge along the chain, right there from the premix that you have received, right there to the point of what was the concentration of the vitamin A you're putting in the product itself. And then it basically gives a sort of assurance to even the regulatory agencies to say that we're getting this data right from the producers already, right? And we could see the information that is being put here. So that assurance is actually there. And also for regulatory agencies, the biggest benefits would say they have access to this fortification data right at their fingertips. And it's not just fortification data, it is what I can call up-to-date fortification data. Because as production is being done, the producers upload this and submit it to the regulatory agencies. So they have the data that they need. And it also helps them to also free up resources, right? So that it's going to increase regulatory compliance. And then in a particular word that I know that the regulatory agencies love to say, it helps them to have risk-based assessment. So by the time you see, you already have the information of your participating stakeholders already. You could already look at the trend. You could already look at what is the data you are getting. So when you're going for compliance, it is a risk-based compliance assessment that you are going for. You can even already interact. And also, part of this building stage is to have continuous engagement with all the users, including the food producers and even the regulatory agencies. So they get to talk about what are the challenges they're facing, what are the things that they're going on currently. And also the system is actually meant to support decision making. So by the time the data, we are able to look at the data, we're able to translate it beyond just data to actually see that what is the information we are getting from this? What are the next steps? We can actually review our food fortification program in the country with this data that we have by the time we're able to translate it. Yeah, Hannah.
Thank you very much. I think it shows you're very excited about this project. And so I assume that you also think it's functioning well.
Yeah.
I had one last follow-up question, and maybe I also open the floor to the other panel members to ask questions. What about if the law says you need to fortify, and if producers are having trouble, will they be honest about putting the data in on what's really happening?
Okay, and if I get your question right, you mean you're talking about honesty and actually putting the right data. Okay. Yeah. So I would say that, mind you, we have a fortification policy in Nigeria. The regulatory agencies actually do this compliance monitoring check with these regulators, with these producers itself, right? So this is just a process of trying to digitize what they do currently and helping producers themselves, not just the producers, basically the stakeholders building trust within themselves. So if I'm providing you with my data, even before you come to me to do the monitoring, I'm already building a level of trust for you to say that, see, I am being transparent, I am doing this. And this is one thing we have seen over time with the current participating producers. Currently, we have 5 producers participating on the platform. And from the data that we get, it's showing, and it's also building a level of trust with the regulatory agencies too. And mind you, the regulatory agencies, when they still go out to do their own monitoring, they are able to verify the data. And over time, the trust is built. Yeah, that is what I'll say about that.
That's fantastic. Thank you so much for your contribution. And so maybe we move to Francis, and because of the interest of time, because I understand you have limited time, but maybe you want to share a little bit about from WFP's perspective and your work on MIMI.
Yeah, thank you so much, Arnold. And really interesting to hear about the experience in Nigeria. WFP does quite a lot of activities in fortification. I'm just going to speak to one of them, which is a project that is funded by Gates Foundation called MIMI, as I said, modeling and mapping risk of inadequate micronutrient intake. And this is something that we're doing when really there's not necessarily the capacity or time for good data systems at present for fortification and micronutrients. So we're really hoping to see if this can be provided in the interim, while we also advocate for better data systems. It's something that we're doing by using all existing data, really making the most of what's already in a data system, leveraging economic and food security surveys that a lot of countries already conduct. We have 2 main analytical approaches. The main one is if a country has relatively good and recent household consumption and expenditure survey data, we can leverage that and model that to estimate the risk that that micronutrient intake is inadequate, and then also estimate the consumption of foods that should be or could be fortified as well. There's another side to our analysis, which is actually using predictive analytics and machine learning that I won't speak to today, but we're happy to share information if people are really interested in that. And that would be something that we would apply if household consumption data are not adequate, or if we're really in a data constrained setting. I'm going to share some slides because I do quite like having a visual to show some of these, if it makes sense. Can you see my slides now?
Yes.
Perfect. Okay. So I'm just going to give it a quick example of what we're doing. Now, given that this particular event is really focusing on West Africa, I'll show an example from West Africa. West Africa, we were in this incredibly privileged position in that many countries in the region have a very good quality household consumption and expenditure survey. I've got a list of these surveys here, and we have an incredible team of analysts who worked very hard to be able to process and analyze these public household consumption and expenditure surveys to be able to estimate micronutrient and food intake. If this is the first time you've heard of these types of surveys, they're a big economic survey that most countries conduct every 4 to 5 years to get mainly a read on poverty and consumption of different goods, including foods in a country. There's usually a survey that asks households about the foods they consumed in the last week or 2 weeks, and we do a few things to that data. We redistribute it to be able to get a good idea of what an individual in the house would have eaten, and we match it to food composition data so that we can get an idea about then how many nutrients a person would have had over that period. And once again, we can provide details on the methods if people are very interested as well. But based on that, because we've been able to access these data for this list of countries at the same time, we can now do something like this, which is map out the risk that within each of these countries, sort of subnationally down at the LGA level, for example, for Nigeria, we can look at the risk that iron intake was inadequate. We can also look at the risk that zinc intake was inadequate. Vitamin A intake was inadequate, folate, and I think I've also got B12 here as well. Now, ideally, this would be measured by individual 24-hour recall surveys and complemented with biomarker data. But as Jonathan and I are actually at a meeting at present that's talking about the fact that there's going to be less prioritization for micronutrient data collection. So we need to also think about some alternatives. And this allows us to quickly visualize who within a country is most vulnerable and where they might be most vulnerable, and then look at potential for filling these gaps with fortification and other interventions. Now, we're really excited about combining forces with interventions like the work of GAIN, where we have some data on coverage and compliance, and then being able to look at the possibility that different fortification programs are able to fill micronutrient intake gaps for different vulnerable populations. One way we're looking at this from the same data source is to also look at consumption of different staple foods. So as I said, we've got this information where people are reporting how many of different foods they consumed over the recall period. And we can then break that down for each population to look at the percentage of households that are consuming a particular fortifiable food, but also when they consume that food, how much they consumed. So being able to have what's called a bivariate map for this. So what you can then assume is if we've got a very dark purple color, a lot of people eat the food and they eat it in high quantities. If we have a very pink color, not many people eat it, but when they do, they eat a lot. Otherwise, a sort of very green-blue color, a lot of people eat it, but in smaller quantities. So let's have a look at how that looks for West Africa. Here we've mapped out maize. So again, thinking that dark purple color, people eat a lot of it and they eat, and a lot of people eat it. If it's more of a sort of blue color, a lot of people eat this food, but maybe in smaller quantities, maybe 1 to 2 portions a day. We can then compare that to wheat, sorghum, millet, and then rice. Now, why am I showing you this? I'm not going to show you any of our modeling results because I'll stop there. But now what we can do is make some different assumptions to this consumption data. If we were to change the nutrient composition of rice or wheat to assume that it was fortified to a standard that might exist or a standard that's being recognized, we could see if that would fill the macronutrient intake gaps of the most vulnerable in the household. But if we then had some updated data from GAIN that maybe the rice or the wheat or the oil is only being fortified at 50% of standards, we could show that that's really having an impact on the amount of micronutrients that people have available too. So we really start showing a health impact of that. I'll stop there, but I just wanted to give a flavor of what it is that we're able to do with existing data and then how we could sort of bring other data that are being collected into that as well. Thanks.
Thanks a lot. This is very interesting. It's also really the first time I hear it in such a detailed level. And maybe it's not very detailed for you, but it's quite detailed for me. And I think one of the elements that come out very clearly is the need to link different projects, because the project we just heard about from GAIN in the 3 countries, and this we have a lot of linkages. I have some specific questions. Based on the household consumption or the income expenditure survey, can you verify whether those gaps that you identified from those surveys are correct or not? And then also, who are the users of the information that you collect? Is it on a platform? Do you have specific interactions with WFP field offices, or are there other stakeholders at country level who use this, or how do you see this?
Yeah, no, great questions. So regarding verifying or validating this, there have been quite a lot of studies now that have looked at validating estimates of inadequate intake from 24-hour recalls with household consumption and expenditure surveys. So generally sort of in the last 10 years, there's been a good, sorry, I'm being told to confirm the language I'm speaking. I didn't know my accent was so difficult to understand. So I apologize if so. So there's been quite a lot of validation studies that other colleagues in academia have done over the years that we're quite happy to then say we feel quite confident about this type of analysis. But then for every country where we do this analysis, we do a series of sort of triangulation process. So if there's any available individual dietary recall data, any available biomarker data from that country, either subnationally or at the national scale, we will do a triangulation process to see to what extent are these data telling the same story? Now, in some cases, just because there's a particular biomarker result, it might not mean that it's directly related with intake. So we also try and unpack that a little bit more and understand it. But I showed you very quickly this West Africa analysis, but when we're working with an individual country, it's a much longer process. We are not interested in just running a whole lot of analyses from headquarters and putting them up on flashy dashboards. We're really interested in first engaging with a country through our country offices and understanding what are your priorities right now with fortification and micronutrients, where do you want to get to and what evidence do you need to get there? And then we design a specific analysis to answer those policy questions. We'll do that with whatever relevant technical group there is in the country. That could be a National Fortification Alliance, it could be a technical advisory group for rice fortification, for example, and really sort of go along, do the analysis together where we can, or at least involve them in the analysis. So we're quite interested in doing that. In terms then of sort of platforms or users, we do put these data once they're analysed on WFP's Hunger Map live, but we're much more interested in an actual sort of longer term advocacy plan for that country and how this can link in. There's no one analysis or one source of data that's going to inform all policy, but this is sort of part of an ecosystem then with other things. I'm sure Becky will speak to this as well, with other relevant information to help sort of start moving towards a particular decision or outcome or change of policy.
Okay, thanks a lot for these answers. So it's, if I understand it well, it's a service that you provide to the broader fortification effort, right? It's not just for WFP programs.
No, absolutely. I think we hope it's relevant to WFP programs, but I think it's probably the sort of larger questions are overall discussions about fortification for a country and their national policy making.
Yeah, and do you have a high demand from countries and from people that use the data or ask for your
We're getting there. We're currently in discussion about scaling up to more countries. We're working in 11 countries at the moment. And so we're looking at if there is a demand, how could we scale up to be able to support more countries, but also to have, I mean, all of this analysis is done in R. Our team have been really good at documenting and making our code open source. So, you know, even supporting others to be able to do this type of analysis so that it's not on one group of people doing it.
Well, I hope that this seminar will increase the demand tremendously for you. So you'll be
We hope so too.
very busy. Jonathan, do you have enough time? Can we first move to Becky and then to you? Is that okay?
Yep.
Okay. So
Becky,
yeah.
do you mind if I go ahead?
Oh yeah, that's fine with me.
No, let's go ahead and do that. And I think it would be helpful because maybe we'll put some of the other presentations into context. But would that be okay, Arnold? Yeah. Thanks. Yeah, so first of all, it's a pleasure to be able to join everyone. You know, at the Gates Foundation, we're in a really privileged position to be able to think about how data for large-scale food fortification can ultimately help drive decision-making, whether it's around informing the design, the monitoring, or the evaluation of fortification programs. And to really help guide that work, we've developed what we call an LSFF feedback loop, where we really consider 7 really important questions that policymakers must face. The first question is, are we fortifying with the right nutrients? Are we adding the right nutrients into different fortified foods to introduce into the population? The second question in the feedback loop is really determining whether the right vehicles have been selected in order to deliver those nutrients into populations. And then thirdly, you know, once we have established or once countries have determined what is that nutrient vehicle pair, to determine whether or not foods are actually being fortified. Fourth question is whether those foods are being fortified to standard or they're compliant. And we've just heard from Gain about the importance of having a digital QA/QC system to be able to measure adherence. But then the next question is really about understanding who within the population is effectively being reached by and consuming those different fortified foods, and whether they are consuming those foods in adequate amounts, if you will, the dose of the nutrients for fortified foods in order to make a physiologically meaningful contribution to improving intakes, and ultimately whether that's translating into reductions in deficiency. So for each of those questions along the feedback loop, there are really critical data that need to be collected in order to help inform those decisions. And I'll just use as an example the first question, which is really whether countries are fortifying with the right nutrients. And in order to make that decision, we really need to have good data on the burden of micronutrient deficiency in populations. We just heard from Francis about one of the key indicators that are used in order to help determine that level of burden, and that is really around the current level of diet or the sufficiency or insufficiency of different nutrients that are being consumed in the diet. There are different ways to collect those data, either through primary data collection, 24-hour recall, household consumption expenditure survey data, or in cases where those data have already been collected, being really creative with secondary analysis, as Francis has just described the MIMI work is doing, in order to really understand what are current levels of per capita consumption of a vehicle, and then of that vehicle, whether that is contributing, sufficient nutrients to the overall diet. The second really important indicator of burden is really measuring vitamin mineral deficiency data. And we know that this is sort of the gold standard, but we also know that it's incredibly difficult to capture data on the prevalence of different biomarkers of micronutrient status. So one of the things that we've been trying to do with countries is to be creative. Now, most of the micronutrient status data that have been collected in the past have tended to be from household-based surveys. They are collected infrequently. They're extremely expensive. So what we've been really exploring is whether there are creative ways in which we can collect those data by leveraging biological samples that are being already collected through routine surveillance. So the iodine Global Network, I won't speak about it, hopefully Arnold could, has really been piloting an approach where countries are able to use antenatal clinics where you have access to panels of pregnant women who are able to provide urine samples, which are then subjected to analysis for the urinary iodine concentration. And really, for a fraction of the cost of doing surveys, it's possible to generate updated estimates of the current iodine status in the population, and again, whether or not the population is experiencing deficiency or not, or having optimal intake. In a similar way, we're working right now in East Africa, in Uganda, and potentially other countries to leverage biological specimens that are collected through infectious disease surveillance. So whether it's plasma or dry blood spots that are collected for HIV prevalence surveys or malaria surveys, oftentimes those specimens are put into biorepositories. What we're exploring is the feasibility of accessing those specimens, analyzing them for the micronutrient content, and then using that as a way to be able to update information on micronutrient deficiency. Why this approach is really important is not only because it is more cost effective, but these are approaches that really put the power of micronutrient deficiency assessment and intake surveys into the hands of governments themselves. It really enables the capacity to be built to be able to generate these data, and to enable these data to be collected on a more frequent basis, not just every 5 years, but hopefully every year or every 2 years. And also, very importantly, in a more granular way at a subnational level, to understand the heterogeneity or some of the inequities or disparities that exist within countries. We believe that having more robust information about what that burden is, which nutrients are most prevalent, as well as what is their distribution, both geographically and amongst different socioeconomic groups, really helps to inform which nutrients should be the focus of fortification programs. In a similar way, what we've really been trying to do is focus a bit more, as Francis described, on understanding what are the best vehicles to use for fortification. And for that, we have a couple of very, very basic criteria. First of all, we want to identify a vehicle that is widely consumed, but also a vehicle that is consumed in sufficient quantities. So again, if that vehicle were to be fortified, that it will make a meaningful contribution. Of course, we also want to know whether that vehicle is centrally processed and whether it's industrially produced, which is enable fortification to be feasible in the first place. So again, just to conclude, within the Gates Foundation, what we're trying to do is think about how these different innovations can come together to generate the necessary data that feed directly into the feedback loop to help policymakers make informed decisions to more effectively design fortification programs, to make sure that they are being delivered and implemented and reaching populations, especially those that are most vulnerable, and ultimately having a positive impact. The other comment that I just want to make, and it's important for this particular seminar to emphasize, is that we really believe that the current environment right now, which is disruptive, provides opportunities for us to think differently about data. In the past, the construct, the paradigm has been for global North institutions to provide technical assistance to the global South. And we really believe that there is a tremendous scope for there to be South-to-South collaboration. We think that this seminar itself is a reflection of having stronger regional collaboration, where countries can learn better and in a more practical way from one another. And we're extremely excited to see this kind of innovation taking place. Whether it was forced upon us because of the disruptions or not, it's something that's very necessary. And if it does lead to a transformational approach in the way that we're approaching the development of data systems, then this is something that's very positive. Let me go ahead and stop there, Arnold.
Yeah, thank you very much, Jonathan, for a very bird's eye view of the way looking at this and all the different levels of to make large-scale fortification work. So I'll come back to the last point you're making, but I'm wondering these 7 steps or 7 data needs, how or the feedback loop, to what extent is it working? I mean, are these different steps working in some countries? Do you see that? And then, so what are the, I don't want to say there's always a need to do more, but what's the opportunity to better make use of that approach for countries? Yeah, let me stop there.
No, it's a great question, Arnold. I think that, if I can be bold and honest, in a lot of regards, and many countries have designed their fortification programs based on the big 5 nutrients, the nutrients that were really widely recommended. And it was just assumed we should have iron fortified foods as part of our national fortification programs. But it's really been where countries are going in and collecting data on the current status of iron deficiency or other deficiencies, and they may understand that perhaps the burden, the extent of iron deficiency is not as great as previously considered. So therefore, the question then has to be raised: how much money do we invest in adding iron to different fortified foods? I think that there are some very clear examples of where that first question, the feedback loop, have actually been incorporated into national planning. Perhaps the best example is in Ethiopia, where a national survey in 2015 revealed very low levels of iron deficiency. So when the government of Ethiopia recently enacted new national standards for wheat flour fortification, they excluded iron from that standard. So iron is not included in the standard in Ethiopia. In a similar way, in the Nigeria Food Consumption Micronutrient Status Survey that was conducted in 2021, they found alarmingly high levels of folate deficiency. Over 90% of women of reproductive age are currently dealing with suboptimal RBC folate levels. And the government of Nigeria then really took a step back and said, what are we currently doing in order to provide sufficient folic acid through fortification? Are we fortifying the right vehicles? Are those vehicles being consumed in sufficient quantities to make a difference? So they have, begun to review their micronutrient policy guidelines and their fortification vehicles and really beginning to take that information into account. So I do believe that a lot of the innovative work that we're doing around data and metrics and triangulation of data has led to already some changes in policy, not only which nutrients should be added into which vehicles, but also what are the different levels or the different standards of those nutrients that should be added to vehicles. And one thing that's extremely important, Arnold, is to document where these actions are actually being driven, or policy decisions are being driven by data in order to encourage use of these innovations. You say that there's always opportunities to do more. I think one of the things that Francis said, that we're in a meeting right now, one of the things we're thinking about is how can we do more with less? And really being very practical and honest about what are the data that are going to be most important to drive decisions, and to really focus on collection of those data. It's always enticing to collect more data, but I think we always have to ask ourselves a question: how useful will these data be to making informed decisions to improve the way that policies and programs are being implemented? And it's tough questions, but I think we're at a point now, and we're dealing with a current global funding landscape where we do have to begin to set priorities and understand what are the key indicators that we need to prioritize, and how can we collect those data to ensure that they are most actionable? And again, I come back to 2 terms. One is the timeliness of data. Are they able to sense acute changes in status that are taking place? So not necessarily collected 7 or 10 years ago, And are they granular enough? Are they available at a subnational level to be able to understand some of the disparities and inequities that are occurring within countries, to use that information to drive decisions and the way that programs are being implemented? Thanks, Arnold.
Yeah, thank you very much. I had a last question, and more from where you sit and looking at all the different aspects on the global development. But what would your message be to a person in a country that has to make, you know, some effort? Because yeah, without data we don't know anything and we can't function. And also what we see, for example, in Europe, that there's no more data on iodine, or inadequate data on iodine, and this issue is dropped from the agenda. Iodine deficiency is coming back. So there's a risk that with the current landscape of fewer surveys and less resources for data collection, and you say the South-to-South interaction is key and think differently, but what would your message be to people at country level to do more concretely? Or because I think this is a very big challenge that we all face at the moment.
No, it's a great question. I think the message, and it's something that we're really thinking a lot about these days, comes down to one word, and that's integration. I think that there are opportunities to be more intentional about building on existing systems within countries. So rather than having single standalone micronutrient prevalence surveys, to think about how it could be possible to capture the key indicators through other data collection platforms, whether it's through health systems, whether it's surveillance systems and the like. We do believe that there are incredible opportunities for better integration and harmonization of nutrition and micronutrient data into infectious diseases or other health information systems. And it's something that we really would like to build out further. Not only does this lead to just being able to produce the data that's necessary for programs, but it does actually lead to a building of capacity within countries, something that we've not done very well as an international community. And I think that we can embrace the moment as an opportunity to be able to really strengthen those systems by being more integrative and building on what already exists. But these are great questions and challenges for us. And we really look to the participants in this seminar to help provide the kinds of insights and the innovations that will help us really be more creative to generate that minimal amount of information that's needed in order to make informed decisions.
Thank you very much, Jonathan. And I know you're pressured for time, so so maybe we move on to Becky. So Becky, so from your perspective, how do you relate to this topic? And also, what are you working on as within the FFI network?
Yeah, sure. Thanks, Arnold. I think that I'm going to show the GFDX website because I think it'll be more helpful for people to see actually how it functions and how country data actually appears on the site rather than just have me talk about it or share a presentation. But I hope that people will see how the data that both Francis and Adetola just mentioned that their projects work on can dovetail into a global platform like the GFDX. So let me start sharing my screen. Okay. All right. So the GFDX stands for the Global Fortification Data Exchange. It is also supported by the Gates Foundation. This website was launched in 2018. There are 3 data stores. Data stores meaning we really take that responsibility. These 3 organizations take the responsibility of making sure that there is quality information on the website. The Iodine Global Network is responsible for the information around salt. The Food Fortification Initiative, where I work, is responsible for the data on 3 cereal grains that are collected here: wheat flour, maize flour, and rice. GAIN is responsible for the quality of data around oil fortification. And so this website, there are a lot of visualizations, and I'm not going to go through all of them, but I've chosen a few. I'm focused on the Africa region. But I wanted to use this kind of landing page to show you the categories of the information that we collect. And if we think about the feedback loop that Jonathan had just mentioned, the information that we consider that countries need to make decisions around fortification programming, you can see that a lot of the information on the GFDX does provide information in the feedback loop that Jonathan's mentioning, save perhaps the burden information around adequacy and micronutrient data. It is around a global level of information, so not that subnational, but we hope that the GFDX, in addition to providing, global benchmarking and comparisons, that it also provides an opportunity for countries to have all in one place, transparent information around their program so that it can facilitate conversation about the status of their fortification program. So first category of information that the GFDX shares is food intake availability. So we consider these three data pieces really important to identify whether food fortification of that particular food is even an opportunity from a practical landscape. Do people actually consume it in quantities, just like how Francis had mentioned that the MIMI project estimates? How much of that food is industrially processed? And people sometimes use this indicator to define whether a food is fortifiable. Can that food be fortified by the private sector in a sustainable and long-term manner? And can actually government monitor it in a feasible manner? Because obviously it's much easier to monitor a smaller number of producers rather than thousands of producers. And then finally, the last indicator is around coverage. How much of the population actually consumes that food? So again, you see that first and third one being those indicators that Frances had mentioned in her matrix. The third category is around legislation status. So who actually, or what countries actually have mandatory or voluntary fortification of those foods I had mentioned. Standards, so what is in the legislation or the standards that are required in terms of the nutrient and the levels and the compounds that are indicated. And then are the regulatory monitoring protocols. So we try to go into a little bit deeper around, well, how is the program actually implemented? Are there foundational documents that actually indicate, guidance or best practices for that country to follow? And the fourth category is, now, if you consider that the country has already identified the foods that they want to fortify, they've already put into place an enabling environment documents that will actually allow private sector to fortify. Well, then the last category is really around how well is the program operating? And of course, you want to know, well, how much of the food is actually fortified? How much of the population is consuming fortified food? Can you estimate how much of the nutrient is actually coming from fortification? And then are there actually evidence from pre and post evaluations of whether there's been health status changes from fortification? So that's just a big overview of all the information that is there on the website, just to point out a couple of specific visualizations. So I'm going to go over our most popular probably map is around the status of legislation. So I've zoomed in here on the Africa region, in particular West Africa, and I have chosen mandatory fortification and of wheat flour. And you can see that from 2003 to 2022, 30 countries have instituted mandatory fortification of wheat flour. You can hover over a country and it'll provide a little bit more information, particularly around the legislation source. We try to be very transparent on the GFDX about what the data source is. So everything is cited and referenced on the website, except for a minority of indicators around program implementation, where unfortunately our current data systems are not very transparent. All the information has to be from reports or published information. It may not be open access sometimes because standards can be on paywalls, but they are country documents. For a small number of indicators, for example, compliance, we will accept expert opinion because oftentimes that data is not very transparently available in countries. Another visualization I want to share, I think that it's very underutilized, is we often categorize fortification as a yes, no, it's a binary. Unfortunately, or not unfortunately, but actually it's a much more detailed situation in many countries. And so when you talk about visualizing information around how well a food is covered and are there nutrients that need to be added in there, you need to consider, well, what foods actually are required to be fortified in that country? Because if you have mandatory fortification of maize flour in Malawi, as is the case here, but you only have certain subtypes that are required, are you missing a specific kind of maize flour that actually is a very predominantly consumed form of maize flour that should actually be fortified and is causing nutrient gaps? even though fortification is in place. So we have a visualization that pulls out from all of the actual national documentation, the legislation and the standards files that actually states, okay, what kinds of foods? Is it all kinds of salts? Is it fine salt? Is it coarse salt? Same for wheat flour and the other foods. Does it only apply to domestic production, or does it also apply to imports and exports? And then finally, the last category is some legislation and standards also point out the intended use of the food. This is in particular around salt. I feel you see often there is reference to animal feed, or there may be reference to, you know, whether the fortified food ingredient should be used in processed food. I will show one more visualization that I think is really important, and that is the country dashboard. And so all of the visualizations that I showed, you saw that they were mostly in a global map form. Well, maybe you are only interested in your country's information. And so we have pulled out all of the information for your country into one place so that you can see how all of the information around fortification, with that feedback loop that Jonathan mentioned, actually comes together. And in places where possible, we've tried to put some interpretation on it so that actually it's not just, GFDX is not just a place where you have data that's accessible, but there's also some interpretation for what it means for decision-making in your country. We really hope that the dashboard, even though it does not provide subnational information, we really hope that it's a place where countries can, when they have national fortification alliances, when they have national discussions around the status of their fortification program, can look at the country dashboard and use it really as a conversation piece. Because one of the barriers that I've seen when I work in countries is data is not transparent. And part of the advantages of fortification is also part of its disadvantages. So food fortification is a multi-sectoral intervention. You require the participation of private sector, public sector, and within public sector, different ministries. And that makes it sustainable because not one individual or organization or agency shoulders the burden of food fortification. But that means that that cross-sharing of data is very difficult because of privacy, because of just, you know, lack of, I think, structures that allow for data sharing. And so we hope that having a dashboard that pulls together all of the disparate information sources in one place can be really illuminating for countries. I've sat in meetings where, you know, people can't agree from two different organizations what the actual data is for their country, or maybe they weren't aware of the data that were available because of turnover in some situations. And before I end, I just want to call out, I know that everyone's questions probably is where does the information come from? And if I can just point out this case in Senegal, one of the indicator around the proportion of maize flour that's industrially processed, this is a personal communication. This is one of the indicators that we allow for personal communication because that information is not always publicly available. And we try to be as transparent as possible. As I mentioned, we provide the information or the name of the individual and their affiliation. We get this information from the countries and from partners that are working on projects like MIMI and from GAIN. So it really comes from the countries, and what we try to do is collate it so that it can be used for decision-making. Thank you.
Yeah, thank you very much, Becky. It's very interesting to see the GFDX dashboard and also the wealth of information that's there. There's one question in the Q&A, if this is also available in French, and I'm wondering if it's not, but if an automatic translation through Google is an option or not.
Yes, so that's something we've been working on. The current website is available in Spanish. Because of the way that the data is set up, it's, you know, most of the information is actually coded within, you know, a structure that is outside of most of the, you know, for example, a lot of the text is under our WordPress page, and that can be auto-translated under Google. But if you go to one of the maps, all of the information under the visualizations are under another structure. So that is why if you try to Google translate it automatically, this information will not translate. However, we are now working on a refresh of the GFDX site, which will allow translation into the GFDX, including the data pages, into all languages. And when I say all, it is very, very extensive in terms of the number of languages that it will auto-translate to. So that is coming soon, we hope, in the matter of weeks, ideally.
That's really great. And also another question is how all of the examples that are being shared in this session, and I guess in the other sessions too, how they're going to be made available. And I think that's always the challenge, right? If you don't know that something exists, you're not searching for it. So how do we? That's not necessarily a question to you, but just in general, how we keep track of all the different sources that are being mentioned. I have a question, Becky, related to the updating the information that you have. I understand and assume it must be very hard to get new information. And I see just on the Senegal example that you mentioned that is the data was from 2017 on the amount of maize that's industrially produced, and some of these sectors are fast moving and changes happen all the time. So how do you deal with a challenge like updating the information?
Yeah, we have a multi-pronged process because the information sits with a lot of different individuals and organizations. Even within an organization, that data may not be available across agencies. So it really hinges on reaching the right person in a country sometimes, unfortunately. I do think that's a limitation within the existing data systems in food fortification. And so one of the processes that we have that we introduced when the GFDX was launched was a harmonized survey that the agencies collectively send out. So, previously the 3 data stores that I had mentioned had different processes in place to collect information about these foods. We wanted to come together and harmonize indicators and streamline that process. And so we have a survey that honestly is still an evolving process. How we've conducted it, the questions that we've asked has changed and will probably change again in the future, because 2018 really wasn't that long ago. And so we're really trying to take advantage of new technology, trying to improve the user experience so that information can be more easily shared with us. But that's one way. So we directly reach out to about 3,000 individuals on our mailing list so that they can actually answer a survey around the GFDX. And that's where you'll see that personal communication come in. Another way that we do it is we partner with organizations like GAIN, WFP, and others where they may have data actually that are relevant for inclusion on the GFDX, because whereas a country may not be conducting analyses on that would provide coverage information, other organizations may. And the third is we just get rolling. We just get rolling information from partners. All the 3 data stores all work in food fortification. As a result, we have extensive networks across the world around food fortification, and oftentimes information just comes in ad hoc to us to correct the information on the GFDX, update it. A lot of it is that word of mouth, which is, a pro and a con, but it's a pro since the food fortification community is relatively small and everyone knows each other. Thanks.
Yeah, thank you very much. And a last question for you before we move to Zanga. What is your wish, if you had a wish for the GFDX, the final objective in terms of its utilization? How would you see that? So to understand what are your next steps in the process, and where would you like to see it move eventually?
Yeah, I mean, this is going to be my own personal wish. I would love the GFDX to become easier to interpret. So I think the GFDX and its objectives has evolved over the years. It really started off as, let's just get the data stores to collate the information they already have and share it so that you don't have to email, GAIN for this information. And, we just align on how we present food fortification information. It's evolved into, okay, now you have the data and you're sharing it, but how do you make that easier for decision making? And so that's what I would love the GFDX to be very, very easy to do. We've obviously tried to start moving in that direction, but I think there's more that can be done. If I could pull out a call to those who are, you know, who have used the site or who will use the site. I saw that someone asked for the link. What we would love to hear stories from the GFDX from countries is, how have you used the GFDX to actually support any decision-making or conversations around your fortification program? Because as Jonathan mentioned, that's such an important piece of knowledge to have in order to improve your service or this product. But unfortunately, as a global website, you know, people don't generally come back to your website and say, okay, I've used the website in this way. It really helped us have this conversation on food fortification and try to rectify why we have such poor compliance. So we would love to hear from countries to understand how you've used the information on the GFDX and where improvements could be made. So having that improved engagement is also a really important wish.
Okay, thank you very much, Becky. It's very insightful, and to hear all the good work that the GFDX team is doing, and there's a lot of effort going into this, I know from personal experience. So thanks a lot. I would like to move to Zanga. And Zanga, vous êtes Burkina Faso. Pour vous partager un peu de travail, ce que vous faites avec CRS par rapport les données de Large Scale Food Fortification. Et nous avons la traduction en anglais, donc vous pouvez parler en français. Merci.
Ok, merci beaucoup à tous. C'est un plaisir pour moi de partager vraiment l'expérience du Burkina Faso dans l'intégration des données de la fortification alimentaire à grande échelle. Il faut noter que Catholic Relief Service, en collaboration avec l'Alliance nationale de la fortification pour la fortification alimentaire et d'autres partenaires techniques et financiers, on fait en fait une analyse de la situation en fait en termes d'utilisation des données et en termes de disponibilité même des données. Donc il se trouve que nous avons des insuffisances en collecte des données et nous n'avons pas des données de qualité au bon moment, au temps opportun. Donc cela nous a donné en tout cas des perspectives vraiment pour développer en tout cas une plateforme qui va permettre d'intégrer l'ensemble des données de fortification. Il faut noter qu'au Burkina Faso, les principaux véhicules sont le sel, la farine de blé et l'huile végétale raffinée. Donc, il faut noter que nous avons des structures de contrôle et aussi les structures de production qui forment en fait l'Alliance nationale de la fortification alimentaire. Donc, à travers en tout cas nos partenaires étatiques, nous avons pu rassembler tous les acteurs pour mettre en place un système basé sur DHS2 qui permet la collecte des données de production, les données de contrôle et aussi les données euh, de, des ménages, voilà, des enquêtes ménages. Donc, il faut noter que nous avons défini ensemble des indicateurs et l'ensemble des indicateurs voilà, permettent de faire un suivi voilà, de la fortification alimentaire et de permettre aussi aux décideurs de prendre des décisions plus éclairées basées sur des données probantes. Donc, je vais partager mon écran pour vous montrer un peu un aperçu de cette plateforme voilà, basée sur DHS2. Ok. J'espère qu'on voit mon écran.
Oui.
OK. Donc, pour avoir accès à cette plateforme, il faut avoir un nom d'utilisateur et un mot de passe. Donc, chaque structure qui collecte les données ont un identifiant qui les permet d'accéder à la plateforme. Donc, il y a plusieurs utilisateurs. Il y a des utilisateurs juste pour, en fait, visualiser les données. Et il y a des collecteurs de données et aussi, il y a des administrateurs, super administrateurs qui permettent en tout cas de faire tout le suivi et la maintenance de la plateforme. Donc, à travers l'identifiant, inscrits dans la plateforme. Donc, une fois qu'on est connecté à la plateforme, nous avons le tableau de bord. Et le tableau de bord est basé sur les indicateurs que les structures ont définis. Ici, nous avons une évolution des indicateurs de la fortification au niveau des ménages, des enquêtes ménages. Il faut noter que ces données sont collectées par la structure, la Direction nationale de la direction de la nutrition. Voilà. Donc, ça nous permet de voir la proportion des ménages disposant de sel iodé, la proportion des ménages connaissant au moins un aliment fortifié. Nous avons voilà, assez d'indicateurs comme ça qui nous permettent en tout cas de faire le suivi. Ça ici, c'est des données d'enquête. Voilà. Donc, euh, nous avons un tableau de bord basé sur l'ensemble de la fortification, à travers la fortification d'huile, et la fortification de la farine et ainsi que la fortification du sel. Donc, ces indicateurs, nous pourrons voilà, faire un suivi en temps réel. Voilà. Donc, il faut noter que après ce volet, il y a la possibilité pour chaque structure, en tout cas, de saisir les données. Euh, Ce compte actuellement est un compte de saisie des données d'enquête. Donc, la structure saisit ces données à travers. D'abord, il sélectionne la structure concernée, donc par la direction de la nutrition, et c'est les données d'enquête. On choisit l'année à laquelle on veut saisir les données et nous avons voilà, l'ensemble des indicateurs qui les permettent en tout cas de pouvoir saisir les données. Donc, faut noter que, en tout cas, c'est un processus qui a été inclusif dès le départ. Donc, ce système est basé aussi sur le système national d'information sanitaire pour la durabilité. Et les acteurs ont été vraiment capacités à pouvoir prendre en main la plateforme ainsi que toutes les structures de contrôle. Donc, un renforcement des capacités a été vraiment mis en place et puis un système de suivi pour, en tout cas, faire le recyclage des différents acteurs qui vont pouvoir utiliser cette plateforme. Donc, je pense que je vais m'arrêter là et puis prendre des questions s'il y en a. Merci beaucoup.
Merci beaucoup, Zanga. C'est très intéressant. Je me demande si quelques questions. C'est qui entre les données pour dans cette plateforme? C'est chaque partenaire ou c'est l'industrie, gouvernement. Chacun peut entrer les données et vous avez des exemples comment les données sont utilisées et par qui?
OK, merci beaucoup pour cette question qui est pertinente. Il faut noter que chaque structure les structures qui composent en fait l'ANF, l'Alliance nationale de la fortification, les structures de contrôle ont un rôle de collecteur de données, donc ils pourront saisir les données. Il y a les structures de production, voilà, qui à travers des groupements aussi ont un identifiant qui permet de saisir et les structures étatiques comme la coordination permettent en tout cas de voir l'ensemble de ces données-là, mais chaque structure en fait que j'ai cité précédemment ont la possibilité de saisir les données et lorsqu'ils se connectent, ils ne pourront que voir eux leurs données. Maintenant, la coordination a une vue d'ensemble sur toute la plateforme, mais chaque structure a la possibilité de juste saisir ces données de faire les tableaux de bord à l'image des indicateurs qui pourront mettre en place pour le suivi. Donc, c'est un ensemble vraiment de procédures que nous avons mis en place comme ça. Et concernant l'utilisation des données, il faut noter que la structure de coordination, en tout cas à travers les différents membres, ont mis en place des indicateurs et pour le rapportage, c'est sur cette plateforme, en fait, les structures, en tout cas, partent pour pouvoir faire les rapports et différentes, en tout cas, possibilités d'utilisation qui peuvent venir à leur niveau. Donc, il faut noter que, en tout cas, c'est un système vraiment aujourd'hui qui permet, en tout cas, de faire ce suivi-là à chaque niveau, au niveau de la coordination.
Merci beaucoup. I'm sorry, I'm switching to French and I see the translation system is struggling. Je m'excuse parce que le système de traduction c'est ainsi confus. Mais juste une autre question, je vais poser la question en deux langues pour tout le monde, pour comprendre. Donc, c'est qui gère le système maintenant et le but final, c'est le partenaire national de continuer cette plateforme. Et notre question, c'est quelle est la différence avec le système que Gain a construit en Nigeria, de Adetola a expliqué. So I'm asking who's managing the platform now and what's the final goal? Is it who's going to manage it and what's the difference with the platform that Adetola was talking about? And maybe Adetola, you also want to reflect on it if you were following the discussion.
Ok, ok, voilà. Donc, merci beaucoup. Actuellement, la plateforme est dirigée par l'Alliance nationale de la fortification alimentaire. Voilà, donc c'est eux qui coordonnent en tout cas toutes les activités de la fortification alimentaire au niveau du Burkina. Donc, ils gèrent la plateforme en tout cas dans son ensemble et ils sont appuyés techniquement par la direction des systèmes d'information en santé. Donc, c'est tout ce qu'il y a comme maintenance est fait par cette direction-là. Et en tout cas, dans la coordination, c'est l'Alliance nationale de la fortification alimentaire qui est voilà, au devant. Donc, il faut noter que, en tout cas, l'expérience du Burkina Faso nous donne en tout cas cette perspective de pouvoir mettre à l'échelle cette plateforme au niveau de la sous-région et qui va permettre en tout cas à l'Alliance régionale de la fortification, en tout cas, d'avoir des données sur ces différents pays en temps réel.
Ok, merci. Et une question d'une des participants, c'est comment avoir accès à la plateforme pour juste consultation des données. So, how can somebody access the platform just to look at the information? J'imagine c'est pour les gens extérieurs de Burkina. I assume it's for people who are outside Burkina.
Ok, merci beaucoup pour cette question. Je pense que cette plateforme est d'abord dans l'utilisation au niveau national et ce n'est pas accessible en tout cas au grand public. Voilà, puisque c'est des données vraiment en tout cas sensibles. Donc maintenant, il y a une possibilité vraiment de pouvoir consulter les données agrégées et une structure qui veut en tout cas avoir des informations passe par en fait l'Alliance nationale de la fortification alimentaire, voilà, qui pourra disponibiliser en tout cas ces données voilà, de manière plus efficace. Mais il faut noter que c'est pas disponible en fait au grand public. Mais notre objectif en tout cas c'est de mettre en fait des données qui peuvent être partagées au public dans une plateforme nationale, voilà, ou qui est accessible en tout cas au niveau international au grand public, voilà. Mais pour l'instant, voilà, pour l'instant, en fait, ceux qui veulent vraiment des données de la fortification à travers cette plateforme passent par la structure de coordination qui est l'ANF, en tout cas, qui pourra analyser cette demande et puis pouvoir le fournir les informations demandées. Merci.
Thank you. And I have a last question. What are your challenges with this platform? Do you have any challenges?
Oui, il faut noter que vraiment nous avons des défis et puis vraiment en tout cas, voilà, ok. Donc en parlant des défis, il faut noter que euh, cette plateforme vraiment a besoin en tout cas de pouvoir être utilisé, d'être utilisé du moins par en tout cas les acteurs au niveau national. Donc, il faut continuer à faire le renforcement de capacité, en tout cas en disponibilisant en tout cas des fonds pour pouvoir faire ce renforcement de capacité-là et aussi sensibiliser les acteurs au niveau de la collecte de données pour pouvoir en tout cas fournir des données de qualité. Et aussi, comme je le disais précédemment, c'est de pouvoir mettre vraiment à l'échelle cette solution au niveau de la sous-région.
Okay, thank you very much. And I would like to ask Adetola, if you followed the presentation, can you comment a little bit on how you look at this from Gaines or from Nigeria's perspective on the platform that you are working on?
Can I get a question again?
So do you have any comments or any reflections on what you've heard from Zanga just now on the platform that they built and comparing it with the platform that you built in Nigeria?
Yeah. Just to say, although I was a bit struggling with the translation at some point, but I was able to get some parts of it though. So I would say that there is still this basic idea, which is about sharing data with those that actually need the data itself, the data transparency that is actually coming forth strong in the platforms that have been developed. So that's a very strong one for me. And I think I heard Sanga also talking about the fact that the data goes back even to the subnational level, which is also a very good point there, because you could actually place it across in different areas to say, according to the different zonal areas, this is the challenges here, this is the challenges there, because one of the challenges of data generally is the fact of having just a single data point, like a national data point, which it's okay to have, but then to tell more story and to have more impact, it's good to have subnational data points, which shows what is actually happening in different regions, different areas of the country itself. Looking also at what we are developing right here in Nigeria, because it's about the producers, and producers are also in different locations, and you also have the information about the different locations that they have. So it also gives a granular level of data information that can actually be translated into the real information that you need for decision making. So I see the level of similarity, and I actually see the point of actually creating something that is useful for your location's context. So I'm talking about contextualizing the development of the data system itself. So we could see how Nigeria contextualized to its own system, and the same is showing from what Zanga is actually just explaining to. Just to say basically that just to point a bit on what Jonathan talked about, which is about learning, sharing learnings, right? We all have different things that we might have developed, and even partners and other stakeholders. So it's about looking at all these different things that we have done and actually contextualizing it to what we really need. Yeah, so that is my reflection on that.
Thank you very much. And were you aware of this platform, of the work that's done in Burkina?
Nah, I'm just hearing it from Zanga.
Pardon?
No, I said I'm just hearing it from Zanga today.
Okay. It's good to hear. Zanga, there's another question. What's the that's in the Q&A. What's the risk for faulty declaration of the data, and where is the server based? That's a question in French. Can you answer those questions, Zanga?
Ok. Ouais, merci beaucoup. Il faut noter que le serveur est basé au Burkina Faso. Le serveur, vous m'entendez, j'espère? Oh, voilà. Donc, la plateforme a un serveur basé au Burkina Faso.
Okay, thank you. What's the risk of faulty entry of the data so that the incorrect data is entered? Donc, la question est, quel est le taux de risque d'entrée ou de fausse déclaration de données?
Ah, ok, ok. Ok, merci beaucoup. Il faut noter que nous avons mis des critères de validation sur la plateforme. Donc, voilà, les critères de validation même permettent d'avoir en tout cas des contraintes qui nous fournissent en fait des données de qualité. Voilà. Maintenant, après aussi la saisie des données, nous avons des séances même de validation des données. Voilà. Après chaque période de saisie, puisque nous avons des saisies mensuelles et des saisies annuelles. Donc, une fois que on finit la saisie, nous nous donnons une période de 10 jours pour pouvoir en fait valider les données avant de faire une publication. Donc, il faut noter que premièrement, on a les critères de validation et nous avons des sessions de validation des données qui nous permettent en tout cas de minimiser les risques voilà, de saisie des données d'erreur. Merci.
Okay, thank you very much. I don't know if there are other questions, but we're running towards the end of this session. Of this very interesting panel discussion. Thank you very much, Zanga, for your very interesting explanation of the situation of your platform in Burkina. And also I want to thank the other panel members for their contributions. I think we have heard very interesting examples of data platforms at the national level and for food fortification and how these data can be made to benefit the not just the program functioning of food fortification, but also for program decision making and looking at the individual stakeholders who are using this data. So whether it is from the industry perspective, from the regulators, or from the government and program managers. I think the linkage between some of these topics that were presented is very interesting, and I think it's worthwhile for the organizers to think about how we can make best use of these platforms, but also how some of the global examples, like the presentation of the MIMI, the modeling information from WFP, and the GFDX that Becky was explaining about, and some of the ideas and approaches that Gates Foundation is presenting, how they can be brought together. Because I think one of the main challenges is when you're practicing at country level or even in an individual organization, that you do not always know what other people are doing. And I think that's a really very challenging issue, that very good resources are available for your program, but that you do not always have knowledge of these or have access to them. So also myself, I hear very interesting experiences that I was not aware of, and that can be made useful in the fields where I'm working in salt hydration. And I think there are great tools available these days to work on data, but also I think within the current context where we have reduced funding maybe for data collection, but that we need to think differently and avoid at all risk that that data collection and data use is compromised, especially what is minimally required for a program to function, and also for our decision makers to be made aware of how well the program is working. The worst that can happen is that something like fortification is overshadowed and not taken into account anymore, and may be forgotten, like what's happening with the iodine agenda in Western Europe. So with that, I want to thank all the panel members very much, and all the participants for listening and for asking your questions. And I hand over to the organizers. Thank you.